another minute or two before we get started. Wanda and I like to keep on time and respect people's time, so we'll get started in just a minute. Well, the time is now 5:33. I know people are still coming in. Please just put your name in the chat and your affiliation. Welcome, everyone, to the September 26th, 2023 meeting of Durham Joins Together Saving Lives Task Force. And on behalf of my co-chair, Dr. Wanda Boone, and I'd like to welcome everyone to this meeting. And I hope that people had a chance to look at Donna's awesome detailed minutes that she always sends out after our meetings, and also the report from the Education Committee and the Mental Health Subcommittee. Those are really amazing reports of great work that is happening. Really impressive when you look at who comes to those meetings, such a broad cross-section of our community. So I'm grateful for all of the committee work, and looking forward to the conversation today. Wanda and I both shared the same story that was on WUNC. I don't know if people heard it, but about students who have just been mobilizing on their own on the UNC campus due to the fatal overdoses that are happening among students. So this is going to be an important conversation we're having today to learn what we can do with what is happening here every day in our community. We know fentanyl is between 50 and 100 times more potent than morphine. A tiny little crystals of it, 2 milligrams, can be deadly, and they can be actually in any drug that's sold on the street or that you can buy over the internet. And last year, 680,000 people died from fatal drug overdoses in our country, and majority of these are from synthetic opioids like fentanyl. And we know that drugs like Narcan and naloxone are one of the only really life-saving measures because fentanyl attacks the airways. So with that, I'm going to stop and turn this over to Dwayne Brinson to give a brief update on where the county is on the use of our opioid settlement funds. Dwayne is our new Assistant County Manager for Community Safety. So I would like to welcome Dwayne and turn it over to him. Okay, is Dwayne not on here yet? Is that what I'm seeing? Oh, okay, looks like he's not. Okay, so what we'll do is we'll skip ahead in our agenda. Okay, it looks like somebody is having trouble connecting. I'm just looking at the messages in the chat. Oh, Donna's having trouble. Okay, well, we definitely need Donna here. Okay, well, luckily this is being recorded, right, Wanda?
Yes, it is.
Okay, awesome. Okay, so we'll plug Dwayne in when he shows up, and we'll turn it over to Colin Miller. Colin, thank you so much for being with us today. Colin is the community liaison with the UNC Street Drug Analysis Lab at UNC Chapel Hill. And I will turn things over to you, Colin. Thank you so much for being here. And please introduce anyone else that you have with you as well.
I'm at home, so I just got my dogs and my partner with me. So I'll skirt the introductions with them. They might show up at various times in the background. And yeah, my formal title is social clinical research specialist, but that's just way too verbose, and we decided that community liaison, I can still be a researcher if I'm a community liaison too. So anyways, can I share my screen?
One moment, and you will be able to do that.
Okay.
Let me do this. Okay, one moment. All right, you should be able to share now.
Okay. Let's see, do that. There we go. Sharing that. Okay, let me switch it to the right mode so it looks like a presentation. Dun, dun, dun. There we go. All right. So I am here to tell you a little bit about our drug checking program and just basic kind of overview of what we've been doing over at UNC for the last couple of years. Why is it not advancing? There we go. Okay. So there's a number of different types of drug checking that are commonly used. And this is sort of a little present or a little slide that shows us kind of the main ones and the benefits and limitations of the main technologies that we're utilizing. So I'm sure y'all have all heard of fentanyl test strips. There are also benzodiazepine test strips and xylazine test strips that are on the market. And these are sort of repurposed strips that have been traditionally used for urinalysis that have been repurposed for identifying fentanyl positive or other drug positive in various different substances. So the fentanyl test strips, basically just give us a yes or a no of whether fentanyl or whatever drug that test strip is intended for is in the substance that we're testing. They're really inexpensive, easy to use, quick turnaround. But the testing is limited to fentanyl detection, and there can be a lot of false positives with these. And I'll get into how these all work together because they are all important. Next, we have the Fourier Transform Infrared Spectrometer, FTIR, which is really good at identifying all sorts of different substances, including fentanyl. But the thing with the FTIR is that it's only really truly accurate to substances that are part of the sample that you're analyzing that are in the sample at a rate of 5% or higher. So with a lot of fentanyl analogs or different types of fentanyl that we see, they're often in the samples that we're seeing in amounts less than 5% because they're so potent. So the bulk of what you're getting is cut. But the FTIR does a really good job of telling us sort of what those general cuts are and what the bigger substances are. And then they can also be used in concert with the fentanyl test strips. If you can't find fentanyl or fentanyl analogs with the FTIR, you use a fentanyl test strip to then check it and see if it is positive or negative for fentanyl. FTIRs are definitely prohibitively expensive, but they're cheaper than the GCMS, which I'll get into next. So FTIRs are typically about the size of a toaster oven and range between $30 to $60,000 for one of these machines. So it is kind of expensive, but there aren't really ongoing costs as far as maintenance, and they're pretty hardy machines. And there is training that needs to happen with the operators of these machines. But these are the type of drug checking instruments that we're starting to see programs in Washington State, New York State, California, and a number of other states as well start to purchase for use in the field, like so people can get drugs checked at a syringe service program or a place like that. FTIRs, the one really big benefit with FTIRs is that you could you can get the results in 10 to 15 minutes.
Can everyone please mute themselves?
Thank you. So
Thank you.
So the FTIR can be like I said, it's less expensive than the GCMS, but the real benefit to the FTIR is that it can check drugs in real time, essentially. So someone could bring in a sample of something and get the results of what that substance is comprised of in 10 to 15 minutes, depending on if there's a backup. So they're very good to have in the field. What we use at UNC is a GCMS, or a gas chromatography mass spectrometer. And they're very, very sensitive instruments. So we can see basically anything that's in that substance or in that sample. We can kind of track it down with the GCMS. The bad thing about the GCMS is that these machines cost usually at least $500,000 to $1 million per machine. So they're not really realistic to use in the field like an FTIR. However, they can be helpful. And what we're doing a lot of with different programs is, for the programs that are using the FTIR, they're sending us the samples that they're testing for confirmatory testing. So we're doing confirmatory testing to validate the results that they're getting on the ground with the FTIRs for different programs. And then with other programs, and this is the bulk of the programs that we serve with the program that we run, the bulk of these programs don't have money for an FTIR or a GCMS, let alone enough fentanyl test strips or xylazine test strips. So we offer this service to a lot of programs to give them some sense of what's in their local drug supply. And I'll get into the details of how our program works next. So here's a picture of Nan Golden, who donated this FTIR that you see in this picture to a program called North Carolina Survivors Union that's located in Greensboro. And in this other picture on the right-hand side, this is, we call this machine Mr. G. And it's our GCMS that is located in the lab over at UNC. So what are the benefits of drug checking? So real briefly, FTIR and GCMS are really necessary tools to help expand our knowledge beyond what fentanyl test strips can tell us, which is just the negative or positive. So the FTIR and GCMS can get us into the new realm of what we're seeing in the drug supply, which is the presence of not just fentanyl and fentanyl analogs, but also different types of adulterants. We're seeing a lot of xylazine pretty much in along the East Coast, and also moving inland some. And then out west in the Pacific Northwest, we're seeing a lot of black market benzodiazepines being cut into what used to be just an opioid supply, so fentanyl or heroin that's being sold. So in this new environment where we're seeing not only new fentanyl analogs and other chemicals that mimic the effects of opioids like nitazines, but we're also seeing new and sometimes terrifying adulterants being cut into this stuff. And the important thing, what drives all this is really that we want to make drug use safer for people who are using drugs. I know there's a lot of people in this country and also in Canada right now that are advocating for abstinence-based treatment approach, and mandatory treatment for folks. I won't get into that, but let's just say that the research does not show that that's really that successful and can actually drive overdose in some ways. But studies have shown that drug checking of the type that we're doing and that programs are doing with FTIRs can really encourage safer drug use practices. And I've seen that on the ground when we've had people come to us with various different substances. And for instance, they're looking for fentanyl that does not have xylazine in it because they don't want to deal with the effects of xylazine, with the horrible wounds that it can cause and the extra sedating effects of it. A lot of people aren't looking for that when they're buying fentanyl. So they're really, these safer drug use practices can be informed by getting people results in a timely manner. So people can adjust drug use behaviors, make informed decisions about their health, and implement other harm reduction practices along with these results that we're getting people from drug checking. So at the individual level, drug checking is a service. So we're offering this service to people who are participants or clients of local health departments, syringe service programs, all sorts of different types of clinics, both MAT clinics that do, methadone or buprenorphine, and also like low cost clinics and things and places of that nature. And so at the individual level, we're providing that service to people to be able to know and validate what is in their drugs or not in their drugs. At the community level, this is allowing us to monitor the drug supply in both sort of the micro and the macro. And the approach is always centered in public health and harm reduction. And I won't get into too much, but harm reduction is essentially the belief that we're never going to fully stop people from using drugs, and that any part of a strategy moving people who have substance use disorders or have struggles with drugs need to begin when that person is still using, so we can mitigate the harms that often end up in death or losing limbs or sicknesses and things of that nature. We don't need those things to be some sort of sick deterrent to people who are using drugs. We need to be able to mitigate those harms so they can have an opportunity to potentially recover and get better. And at a minimum, even if they continue using, we're at least keeping that person safe, which I'm sure their mothers, fathers, sons, daughters, and family members and people who love them really care about. So drug checking in practice. We try to lead through both lived experience of drug use and science. So one thing that's really different about what we're doing with this drug checking is that we're also employing and working with people who are active drug users or also have lived experience, former drug users. And we're trying to align the science with the community needs. So we see the need in the community for people have no idea what's in their drugs. We're seeing overdoses, so on and so forth. So we're really trying to, see what the community needs and answer that need. We talk a lot at UNC in our program about science as service and how we need to be, sort of repurposing the tools that have long stood behind the ivory tower walls, and repurpose them or figure out how to get those out into communities that desperately need them in order to save lives. So I'll get into how our program works. So we designed the UNC drug checking kit, which you see on the right, really after we had been using way too many of these drive-through self-administered COVID test kits and swabbing our noses and whatnot. But we realized these were easy to digest sort of, way to get a sample, and we could do something very similar with the drug checking kits at UNC. So these drug checking kits, they contain a card, which is part of what we do for data collection. So this card has, as you can see, instructions on one side, and on the other side, it's things like, what drugs are you expecting this to be? What are the textures of the drug? How did it make you feel? Was this sample involved in an overdose? How the sample was collected and all that kind of stuff. So all these things, we pull data points that come off of these cards. So the kit will have one of these cards for them to fill out and return, and also a vial of acetonitrile, which is what people put the drug sample into. And we could get samples both from actual physical drugs, which we only need about 5 to 10 milligrams of for a sample. And we can also do things like swab the inside of empty drug bags, or take a little sliver off of a pill, or drop a used cotton that has been used to filter someone's injection into the acetonitrile. Those vials are sealed up and mailed back to us. We send all the groups that we work with prepaid postage paid mailers. So they basically take the vial with the sample in it and this card filled out, and then send it back to us. And there's also a number of different implements in the kit to help them collect samples. So there's gloves, there's a sterile surface that they can unfold and put out if they don't have a sterile surface available. There's swabs, there's different kinds of spatulas and scoops, and also a little pencil, a little golf pencil, so they can fill out the cards and everything. So that's kind of the rundown of the kits. Important also to note is that one of the things that we do in the kits, we have a little blue card as well that has a QR code and a link on it, and also a number. You can see on this white card in the corner, it says sample number. When we send out these kits, we number the card, the vial and the kit itself, and also the blue card that's inside these kits with all the same number. And that blue card is given to whoever donates the sample. So whoever brings in that sample of drugs, they can go check on our website once the results are posted by just typing in that number into the search field in our website. And that way they can access their results completely anonymously. They don't have to give their name or any sort of information that would identify them, even when they bring in the sample for collection. This is an example of some of our, one of the programs that we work with, which is holler harm reduction up in the North Carolina mountains. And this is Ainsley Bryce, who's one of the program operators there. And this is some shots of them collecting. So on the left-hand side, you have a cooker with that's been used for injection. And in that cooker, you see a cotton and a bunch of brownish residue. And so that cotton could be directly put into the vial for collection and analysis. And also, as you see in the picture in the middle, that's Ainsley swabbing the inside of a container that contained drugs, and then she will put that swab back into the vial and get as much of that water squeezed out of the swab as possible. And you see her sort of swishing the swab around in that last photo. So this kind of just shows, you know, this is how collection is done at the various sites where we have collection happening. And when people can go and check their stuff, they come to this website. So this is the main picture or main page of our website, which is actually in the process of being redone since we hired a computer person that's been really a game changer. And so he is programming our new site and a bunch of stuff to make our lives easier. But on this main page, it has the main search window that you see here where they can type in sample ID, location, or type of drug. And then on this next panel down here, we have current status. So we can communicate very quickly whether, you know, we are taking samples, we aren't taking samples, there's a problem in the lab, things like that. Because we've had issues with, you know, the GCMS went down and we had to wait a week to repair it. So we communicate that kind of stuff through this current status window. Now this is sort of the meat and potatoes of it. So this is an actual sample that was collected from where I live in Winston-Salem. And you can see this is the base. So someone would come if they got the number 300,298, they would be able to go to the website, type it into that field, and have their results pop up once the analysis was done. So it has location, date, what it was sold as, physical description, and then a list of the primary substances detected. So we can see right here, we have xylazine, mannitol, 4-ANPP, which is a precursor of fentanyl, p-fluorofentanyl, nonspecific sugars, which we see a lot of because that typically is indicative of a cut, and fentanyl and heroin, all in this same substance. So then we have also below that, beneath the primary, we have a little bit of information that self-populates if we find trace stuff in it. So a lot of these windows and these little nuggets of knowledge and stuff are self-populated by what we find in the substance. So if we find fentanyl and xylazine, this fentanyl and this xylazine paragraph will pop up and just give people some basic information about it. And you can kind of see the rest. I'm running short on time here, so I better get through this. But so that's what people see when they type something in so they can see their results. And yeah. So how far have we reached so far? So we've sent out 4,464 kits. We've gotten 2,668 samples. And we're currently operating in 30 states across 136 programs. 37 of those programs are in North Carolina. So just in the time that we've been around, we've been making a big impact, and really, it's been really cool to see different people either validate or verify various different, you know, rumors about drugs that are happening in their community, or, you know, or fears about drugs in their community. We're able to actually like take the substance that someone overdosed on, figure out what was actually in it, and report that information back to folks. And we've had some really cool opportunities to test some really interesting stuff. There was actually a substance that was sent to us that was sold in a tobacco store, and it was like the K2 spice stuff. But we tested that because someone had overdosed on it and found out that something being sold like a legit place of business in New York was actually, this stuff was positive for 3 types of different nitazines, which are very similar chemicals to the fentanyls in the effects they have, and also 2 different types of black market benzodiazepine, bromazolam, and I can't remember what the other one is. But just goes to show like that what we can do on the ground and what we can do with a program that's sort of nimble like ours is that we don't have to let people wait, or make people wait 6 months, 8 months, a year for results, like a lot of the bigger labs do, and a lot of the law enforcement labs, are taking that long to get results. So we're able to, sort of be the stand-in and not only get results to people who use drugs, which I would argue are the most important people to have this information, but also we can, we can shoot down bad claims of when someone says there's cannabis tainted with with fentanyl. Okay, well, send us the cannabis and we'll test it and we'll see if there's fentanyl in it. It's been a very good program in sort of helping to root through what is true and what is not true in this environment that we're currently operating in, that's full of myth and rumor and bad solutions to even worse problem. So that's all I got. There's my information, and if we have questions or whatever, I'm happy to answer any.
If you have a question, if you would raise your hand so we can recognize you, and if you would stop share, Colin, that would be fantastic.
Oh, there we go. Stop share.
Thank you.
Yep.
Any questions? Well, I have one. So my question is, what do the North Carolina results look like, and specifically Durham? I guess maybe you'd have to go back and check and send that to us.
Yeah.
Oh, go ahead.
Oh, no, go ahead if you have more.
No, I'll stop there.
Okay, so I don't have Durham specific information, but I'd be happy to put it together if you guys would like, because we've been taking samples from folks in Durham for over a year now. So we definitely have a presence in Durham, Raleigh, Chapel Hill, the triangle. Now for North Carolina, there's definitely some interesting results that we've seen. I'd say the biggest one is xylazine in the supply, because we've been able to actually validate, first of all, one of the first detection of xylazine in the drug supply was actually done on that FTIR that I showed y'all at the beginning. That FTIR was the machine that was used to first detect it in the drug supply a few years back. So there you go. Like we maybe we wouldn't be as far as knowing, what's going on, because at the time we were looking at these weird, wounds that people were showing up with, and we were like, what's causing this stuff? And no one really knew until we figured out the xylazine thing. So we've, identified the xylazine and knew from past work that had been done in Puerto Rico what these wounds looked like, because xylazine's been around in Puerto Rico for since about 2005 or maybe even earlier. But it allowed us to look at the drug supply in North Carolina, and I think it's about somewhere in the neighborhood of 700 to 800 samples. I can't remember the exact number, but out of those samples, around a quarter of them tested positive for xylazine. So now there's a caveat there, in that people often send us samples that made them feel funny or that they think might be contaminated. So we might skew high. I'm definitely not saying that 25% of the dope in North Carolina has xylazine in it. However, it's a big enough sample size that it definitely correlates with what we've been seeing turn up as far as wound care needs in ERs, and what we've been hearing from people on the ground and what we've been seeing on the ground. It falls in line with that as far as the amount of xylazine that we're seeing in the population. another interesting analysis that we did, and we're actually in the process of creating dashboards for all these different things, so people can see in real time as results come in, how much xylazine is being detected, how much fentanyl are we seeing in cocaine samples, how much fentanyl we're seeing in methamphetamine samples. And we've seen some really interesting results from the stimulant analysis too, because we've found that, so crystal meth comes in crystals, and if you crush those crystals, it's a powder basically, you know, so you break down the crystals. What we found is that if you take all the crystal samples of methamphetamine that we had only 2 that had fentanyl contamination, whereas we had like 45 if it was powdered meth. So we can tell people just from looking at the data that there's something going on here. Also, with cocaine versus crack, no crack samples have tested positive for fentanyl, whereas 58 powder cocaine samples have tested positive for fentanyl. So we can see what the variation within the drug supply, not just by substance, but by the way that that substance is presented to the user.
Well, thank you so much. And I look forward to getting those results, and I'll make sure they get out to everyone. And Lindsay, your hand is up, so please ask your question.
Sure. Thank you. Colin, I was wondering if you could just tell us more about, especially in North Carolina, but across the US, like what types of organizations you're partnering with. I'm with the Durham County Public Health Department. And so
for sure.
You know, how many are harm reduction organizations? How many are health departments? That sort of thing.
Yeah. A lot are harm reduction organizations. We have a number of health departments as well. We just had a bunch of federally qualified. What's the word? Federally qualified.
Federally qualified health centers. FQHC.
There you go. FQHC. I knew the FQHC part, but yeah. So we're working with a number of FQHCs. The cool thing that I really want to get across to, since y'all are North Carolina folks, we got money from the collaboratory, the North Carolina Collaboratory, and it was from the 15% of funds from the opioid settlement money that was staying at the state. The other 85 was dueled up like amongst the counties for county commissioners to pay or to dole out in their own counties. But some of that 15% found its way to our program, which allows us to offer these services to pretty much any entity within North Carolina completely for free. So if a health department wants to work with us, if a clinic like a methadone clinic or a buprenorphine clinic, or even a treatment center, any kind of, as long as they're not trying to use those results in a punitive manner and in a constructive manner, that's really like one of our only sort of like rules. And also is that program has the ability to collect samples, as i.e. they have regular interactions with people who are actively using drugs. But besides that, we'll pretty much, you know, as long as people can commit to those things, like we'll work with just about anybody. And we're really seeing a lot of different kinds of programs, and we have sort of a range of groups that are working with us. So,
and so just a quick follow-up, it sounds like there's no particular threshold of minimum quantity or maximum quantity.
No, we're in super growth mode. Like it started with Nab, Aaron, and Mary Alice, and then I got added like a year and a half ago, and then we've hired 3 new people, and we're in the process of hiring another chemist and purchasing our own GCMS. So we're scaling up like big time. And we just got a bunch of new contracts from programs that got this OD2A funding. So there's a number of larger, like most of them are health departments in larger cities like Denver. And we're working with them to do drug checking in their communities as well. So yeah, we're scaling up big time.
And I will confirm with the Morse clinics that it's very easy to get on their list and work with them. And they can send as few as 5, as many as you need, but 5 is a good number.
Yep.
Thank you.
Yeah, and the Morse Clinic folks were the first like clinic as far as like any sort of like medication for the treatment of opioid use disorder type of clinics. Like Morse Clinic was like, hey, what are y'all doing over there? Like very early. So props to y'all.
So
Well, I just wanted jump in if nobody has any other comments. I just wanted to thank you, Colin, for the amazing work that you all are doing. And you're, if I'm not mistaken, one of the few programs like this in the entire United States. So,
Yep.
you know, UNC is really leading the way on this. And I hope that we will all take advantage of this incredible resource that we have right here in our backyard. So
Awesome.
thank you
Thanks
so
very
much.
much. Thanks for having me, all.
Wendy, are we ready to go back to Dwayne Brinson or?
Sure. And Dwayne is on here, at least by phone. I'm not sure, but I did connect with him and he was stuck in traffic. So Dwayne, can you hear us now?
I can, thank you. I'm between destinations, so I'm on my phone. Sorry about that. But yeah, thank you all for having me. I think it's
Thank
my
you,
first.
Dwayne. I gave you a little introduction before. And
Okay,
then I was like,
was
okay,
good.
Dwayne, I'll turn it over to you. So I don't need to do that introduction again, just to let you know.
Okay. Yeah, I just wanted to give the group, and I appreciate the invitation. Just want to give the group a very brief update on where Durham County stands with opioid settlement funds. At this point, September 27th, tomorrow, is the deadline to have all 3 annual reports due into the state. So we are filing those. They have been filed. The opioid settlement manager position that has been approved by the board, and we will be posting that very, very soon, so we can get that management position. The position is going to administer the program up and going, and from there, I think it was at the May board meeting just before Gudrun left. She gave a really good presentation to the Board of Commissioners on the structure around this program. It's some very important work, and we want to get it right going into it. Right, so we're going to take some time, develop a structure, an oversight committee, community partners, how to apply for funds. It kind of reminds me of the ARPA process. Developing that structure up front so that we go in with a lot of answers instead of a lot of questions, and so that we can get some big wins and get this money into the community and making an impact. Over the coming weeks, we're going to have a lot of substantive work. We are going to sit down, Justice Services, Public Health, myself, a lot of different departments going to sit down and talk about some funding strategies for this year. As far as the process itself, we have to go to the board and outline these strategies and turn in a resolution to the state that identifies how we're going to spend the money. Right? And that's essentially the authorization for us to spend the money on the front end of the fiscal year. And then on the back end of the fiscal year is kind of where we are now in filing these reports. So in the coming weeks, we'll be doing that work, identifying the strategies, identifying the initiatives, capturing some of the big wins that we can do this year, as well as developing that overall structure that we need for this program, because it's going to be for the next 18 years. Durham County is very fortunate that we're getting this millions of dollars over the next 18 years, and it's such a great opportunity for us to make an impact in the community. So that's my update for now. I look forward to the first quarter meeting of next year, and I feel like at that time, we'll be able to really talk about some good work that's being done in Durham County through this program and through this funding.
Thank you so much, Dwayne. And I'll just also add to your update that we did fund a few things already with the opioid funding. We moved ahead with some time-sensitive things. One was the funding of the community linkages to care program through public health that Lacey Schofield is over. And we also moved forward with approving an MAT medical director for the detention center. And we did hear a presentation recently from public health and a lot of their staff, Lindsay, that is working on harm reduction and just in light of the urgency around overdosing and related to harm reduction, public health is going to bring something back to us. So those are just some of the things that we have, that we are taking action on and being responsive to. And I guess if anyone has any questions for Dwayne, I don't know if you can see people's hands, Wanda. I can't with the agenda up.
Yeah, I don't see any questions at this time.
Okay, well, thank you so much, Dwayne, and we look forward to hearing more at our next meeting.
Absolutely. Thank you.
Thank you so much. Okay, so Wanda, I'll turn it over to you to introduce the next speaker.
Well, thank you so much. I am introducing Dennis Hamlet. I think I have that. I have two screens up. Yes. Public Health Education Program Manager, Durham County. And Dennis, please go ahead with your information about the vending machines. Really exciting development.
Hey, good evening. Maybe do a quick audio and visual check. Are folks able to see and hear me?
Yes.
Okay. And Dr. Boone, may I have permission to share my screen or allow me to get permission so folks can see my presentation?
You should be able to do that right now.
Okay, sweet. Give me one moment, everyone.
Oh, let me stop sharing this. Okay, try now.
How are we looking, Dr. Boone?
Great.
Sweet. All right, well, good evening, everyone. Thank you for having me. My name is Dennis Hamlet. I'm the Communicable Disease and Maternal Child Health Program Manager within our Health Education Division at the Durham County Department of Public Health. Since I was invited to this meeting, we've actually was able to successfully launch Durham County's vending machine project. We're super excited to announce this project as these vending machines will afford Durham County the opportunity to not only utilize a new and innovative approach to protect the well-being of our community members, but is also a tool that we plan to leverage to promote the health and safety of individuals who use drugs. The goal of the Narcan vending machine project that's located at the Durham County Detention Center is to provide, free Narcan naloxone 24 hours a day, 7 days a week, free of charge. The detention center is the ideal location for the launch of our machine number one, as I call it, because it provides an environment that's safe. And this may be subjective, but I would consider it discreet, depending on what time of day that you go. The machine is conveniently located at the front of the building, so folks are able to access this life-saving medication without even interacting with anyone. Narcan vending machines are another great project to have or to implement within various counties because it provides Narcan outside the traditional brick and mortar settings, such as pharmacies and health departments. So I want to give you a little background about the naloxone vending machine project. So the very first Narcan vending machine was located at Los Angeles County Jail, and this was in 2019. That machine was received well, and in 2021, a combination of several organizations, I would say SAMHSA, which is the Substance Abuse and Mental Health Services Administration, the Opioid Stimulant Substance Abuse Program, the CDC Overdose Data to Action Grant, and a couple of nonprofits supported the vending machine projects in Indiana, Michigan, Ohio, North Carolina, and West Virginia. Durham is probably the 8th or 9th county in North Carolina that was able to implement a Narcan vending machine project. Counties such as Guilford, Buncombe, Forsyth were some counties who were able to get some of this grant funding to purchase the Narcan vending machines. The project was piloted by Tara Blair, who was with the National Center for from State Courts. We met with her last year, and she was able to provide the framework for Durham County's vending machine project. Although she couldn't support us with funding, she was able to, connect us with the vendor, explain some of the processes, and she was even able to let us know what worked well and what didn't work well with the other machines in the other counties. So it was, although we weren't one of the early innovators of the machine, it was good that we were able to learn from other folks' mistakes and mishaps. So the overarching goal of the naloxone vending machine is to, one, improve the quality of life and increase the length of life for people who use drugs by increasing low barrier access to naloxone. So I would say low barrier access for the purpose of this project and for other public health or harm reduction opioid response projects is to, one, provide free supplies with no human interaction and with comprehensible messaging. So some folks have stated, I've seen several articles and social media why detention centers identified as the site for some of these Narcan vending machine projects. But one, overdose is the leading cause of death amongst individuals who are returning from incarcerations. So when we implement this project, we want to target some key individuals who may have interactions with individuals who are incarcerated and soon to be incarcerated, formerly incarcerated individuals. So it includes community members, stakeholders, organizations, and public servants who provide services to incarcerated individuals, friends and family who visit incarcerated individuals and who may be soon be released, so they're able to have these Narcan kits waiting for them if that individual, unfortunately, decides to use illicit drug use. We also want to target individuals who are most likely to witness or experience an overdose. And this is my personal belief, this is everyone's responsibility. So this is the reason why we have EMS, police officers carrying naloxone, public servants, and public health and social services. Naloxone should be readily available. We've even have a collaboration with the Durham County Library where they're able to access naloxone or Narcan if someone to overdose on their property or facility. And we also want to connect with individuals who are not already connected to harm reduction services, and also individuals who may stray away from it due to stigma. So some project goals, again, we want to improve the quality of life and increase the length of life. So the way we do that is to reduce overdose and overdose death, increase community education awareness of our various harm reduction projects that we implement in Durham County. We want to reduce stigma related to substance use. Having a Narcan vending machine is a great way to normalize having life-saving medication readily available. And we also want to reach and engage communities who are disproportionately impacted by overdose. And the jail provides that 24 hours a day, 7 days a week environment where folks can easily, if they're visiting downtown or if they are aware of where they can get naloxone readily available without having to interact with the human, we can get those individuals who may not normally access it, get it pretty easily. So the Narcan Near Me project is what the Durham County Detention Center coined Narcan vendor number 1, as I call it. Narcan Near Me is an excellent name. This project was a partnership between the Durham County Detention Center as well as the Durham County Department of Public Health. We launched Tuesday, September 12th, 2023. Just a little background information about each machine. These machines were provided by Schaefer Distributing, which is a vending machine, a company located in Ohio. And these machines are specifically curated to distribute Narcan as they remove the payment mechanism and they alter the machine coils to align with the size and shape of each naloxone kit or Narcan kit. Each machine holds about 150 kits. Each kit holds 2 doses, so the entire machine provides 300 doses of Narcan. We were able to fund this project since we missed out on the earlier grant from a mixture of county as well as grant-funded sources. Oh, sorry. Yeah. So if you see on the slide here, this is the sign that we created just as a point of reference for folks who may need additional instructions on how to use Narcan. As you all may be aware, each Narcan kit does have a pamphlet or a short instructional use on how to use Narcan, but we provided that additional resource for folks. On each vending machine, we intend to have 2 QR codes that participants can use. One is going to link them to a community resources page, which is actually our public health website, where they're able to access the Durham County Resource Guide, as well as providing individuals with information on other resources they can obtain from public health in terms of opioid use and illicit drug response work. The second QR code is just is going to link those individuals to a demographic data survey. It's completely anonymous, and they're able to opt out. This isn't mandatory, and individuals are not required to complete this survey. So again, this is kind of productive in terms of having a low barrier access to Narcan. So we made this voluntary, but if individuals decide to opt in, this information that we collect is going to help guide our future efforts. So we do collect age, gender identity, race, ethnicity, and zip code. A zip code is going to be the indicator we're going to use to see where we can possibly identify future sites for the Narcan vending machine. So future planning. I numbered these machines. We have Narcan 1 at the detention center. Narcan 2 will be at the Durham County Department of Public Health. The machine is there, however, it isn't operational, as we are looking to obtain more Narcan kits. So one of the lessons learned is that when these machines are first implemented, they emptied out within a week or two. And each Narcan kit is about $44. So we want to make sure that we have enough to keep each machine full, as well as having backup kits to refill at least once or twice within a 3-month period. Some other things that we want to consider is bolstering our evaluation efforts. Again, that short survey is, I'd probably say it's a low barrier way of collecting information, but eventually we want to kind of bolster our evaluation efforts. And so we can look at what we're doing in terms of impact, in terms of process, and especially outcome. So seeing how we can improve our data collection efforts to guide our future work. We eventually want to have all of our content, both written and digital, translated into Spanish to be inclusive to individuals who aren't able to read or write in English. We're also working with leadership, and I would be remiss not to thank the county commissioners and our Board of Health to find funding not only to purchase future machines, and just for your awareness, each machine is about $7,000 to $8,000, and each Narcan kit is about $44 a piece. And then we want to do a comprehensive harm reduction approach. So outside of the detention center, we can repurpose these machines. We can fit these machines to fit safe syringes, fentanyl and xylazine test strips, condoms, and other harm reduction supplies if need be. So this slide here serves 2 purposes. One, to share with you how many naloxone kits our Durham County Pharmacy has distributed over the year, and is also as a placeholder for myself as I update this slideshow when I'm able to get more data in terms of the vending machine output. But in 2023, our pharmacy was able to distribute 975 kits. And as of now, as I look at the machine, we're about 80% full, which is great. It's been steady. We've been getting reports, and we're getting about 3 or 4 clients a day, with most folks grabbing 2 kits. So again, 80% full is just a visual estimate. I would be remiss not to mention the individuals who made this project possible, as this was truly a collaborative effort. Number one, our Durham County Public Health Leadership Director Jenkins, Christian Patterson, Liz Stevenson, the leadership over at the detention center, Sheriff Burkhead, Chief Hawkins, Captain McKinney. We had the pleasure of working with the Great Detention Center because one of the earlier barriers in the early implementation phase of some of the Narcan vending machine projects is that the detention centers and the jails simply didn't want them there. So I'm thankful we have some folks who are, who have the health of Durham County residents as the #1 priority in making this happen. Definitely want to give a shout out to our medical director, Dr. Jenks, as well as the various divisions and the staff from these divisions who made this possible. I see my supervisor on the call, Lindsay Bickersbach, Lacey Schofield, Ms. Willa Allen Robinson, who was a part of those earlier conversations when we first conceived this project, the Durham County Pharmacy, our administrative department who handle all our contracts, population health, who help with the surveys, and definitely Dr. Alicia Smith from our communications department. So again, my name is Dennis. I have my email here, my phone number, and I'd be happy to answer any questions. But again, thank you for having me.
Dennis, I'm Arthur Payne from the Morse Clinics, and an awareness sort of as the next level of the OTPs that are present in Durham also get naloxone. So it would be a wise partnership to say, if this machine is empty, you can also get naloxone at these other spots. I don't know how to implement that per se, but that's an idea I have.
Okay, thank you. I would love to connect with you after this call.
And,
Of course.
That would be great.
and Carlisle put in the chat that naloxone is available through the DHHS portal until tomorrow. If Durham County or others are interested, it just flipped, in requesting nasal naloxone, here's the link. So that is in the chat as well. Thank you so much. Are there any other comments or questions for Dennis?
Good evening.
Oh, go ahead. Nancy, you go ahead.
Thank you. I just wanted to say, Dennis, that I am very glad this is happening, and that this is a great idea and opportunity that you're working with, because stigma is very real. A lot of people don't get easy access to it, and I'm very happy this is established, and I'm very proud of you. That was a great presentation.
Thank you, Nancy. It's a pleasure to meet you.
And I just want to say thank you, Dennis, for your great work. This is really exciting. My question was, I know that you mentioned the naloxone kits are pretty expensive for the 2 doses, I guess $44. And I guess those are the ones that are nasal administered, right?
Yes.
Has there been any discussion about actually the naloxone, which is the injectables? Are we trying to, is there any policy related to not using naloxone? Because that is a whole lot cheaper. Although I do understand it involves a needle, but my understanding is they can be purchased for like $5 each.
Yep, definitely.
Yeah.
We definitely considered the injectable. The Durham County Detention Center doesn't want any syringes on their facility. So unfortunately, that vending machine will have to be Narcan brand only. When we consider injectable naloxone, when we consider safe syringes, these supplies could be offered at public health, the library, and future sites. But of course, that's going to take some approval and planning with my leadership as well as our medical director. But it's definitely on our radar as it is a cheaper option.
Great. I'm glad you all are looking at different solutions for different places. Great.
Are there any other questions or comments for Dennis?
I have a couple for Dennis. Dennis, this is Hilda.
Yes.
I hope I'm not repeating something that Arthur said. The meeting kind of zoomed out, but it is a great idea to have the vending machines. However, how do you ensure that those getting the packets are not taking 4 and 5? And, we have to consider the criminal element due to the population that I think most of us have worked with.
Yep.
So there is the possibility of sale of the kits if someone is getting 4 and 5 or more out of the machines because they are free. Are there any safeguards?
Yes, Hilda, that's an excellent question. One point I would like to make, was in terms of, I guess, the black market sale. So when public health first initiated our harm reduction work, we gave out safe syringes and Narcan and naloxone, I actually consulted with my friends over the North Carolina Harm Reduction. And what the guidance that was provided to us is that we necessarily cannot worry about the resale of naloxone. That's just something that they recommended that we're aware is happening, and it may happen, but that's not something we should focus on. If folks, decide to resell, then one, it's still getting out there in the community, but I don't think that's something that's out of our scope in terms of what we can manage. We public health, we offer other free supplies such as condoms, and some of those condom brands are very expensive, and we distribute thousands a year. And yes, of course, at some point in time, there may be a resale of those condoms. And that's just something that as public health public servants, we really can't focus our energy and worry about that. And that's just what I received from Lofton at Harm Reduction, because I actually asked that same question back in 2016. And you brought up, I wanted to mention another point. Was that a two-part question, Hilda?
Okay, the other part was, is there a limit on the number of packets that you can get out of the machine? Say if you get 2, does it limit that? Probably not, because someone can come right behind them and get them. There's probably no way to gauge that either. So
there's no limit. In one of the early stages of the signage, we did place only take what you need, but we didn't feel comfortable with that language, so we actually removed it. So far, from what was being reported, most folks are only taking 1 or 2. But one strategy we've identified as we attend listening sessions and hear from other folks is that actually keeping the machines partially full will actually discourage folks from hoarding Narcan. So once we filled it at 100% at the launch, to make it look nice for the media, but going forward, we'll probably only keep it about 60% capacity to deter folks from hoarding Narcan. Great questions.
Thank you, Dennis.
Yes, ma'am.
Anyone else? Okay, so thank you.
So I actually just had a quick comment. I'm sorry. Your contact info, it was brief on your presentation. Would you mind putting it in the chat just in case we have any further questions or?
Of course. That's easy. Yep.
Thank you for that. That's very helpful. Next, we have naloxone distribution in the community by a mobile integrated healthcare MIH from Captain Helen Tripp, Durham County EMS MIH Program Manager.
Thank you. I'm going to share my screen if I may.
Let's make sure. Yeah.
Perfect. Hey, thank you for giving me a chance to give y'all an update on the grant work that we have. We had received a grant from SAMHSA last year, and whose purpose was to provide Narcan kits primarily to 2 groups, which pretty much covers everyone. First responders, so that would be law enforcement, fire, police, EMS, and others that we identify as first responders, and to the community, especially those who in areas that are at risk of having persons on their facilities who may overdose. Along with distributing Narcan kits, the grant covers education. And I'm glad to say that we were approved for year 2 as well. So this is a 4-year grant, and we have to be approved by SAMHSA each year for that. So we've been approved for year 2. We got a late start. Anytime you have a grant, there's all these infrastructure things you have to do to get going. So we haven't done everything we wanted to do, but I still am pretty proud of what we've been able to accomplish, because so far we have been able to distribute over 1,200 kits. And this is, I mean, I'll show you the slide who that has gone to in a little bit. We've also been distributing fentanyl test strips, and the microscopes go along with the test strips. And then we've provided education to several groups as well. Our distribution has gone to first responders, community sector, NC harm reduction, and Durham County EMS. And so with the first responders, that includes the Durham Police Department. They had already started working on getting Narcan kits out to their officers earlier this year. They had received some grants through NC Harm Reduction Coalition, but only about 200 kits, 250 kits. So we were able to provide them another 200 kits, and we are going to be helping them to restock kits as they use them moving forward. They're doing their training through the DEA. It had some training that they had already lined up by the time we got in touch with them. But I'm still excited that the police department has finally got on board with carrying Narcan kits, because that's something that the community has been working towards for quite some time. We've also provided kits for NC Central Police Department, and we did training with them. NC Harm Reduction is doing the majority of our training, because obviously they have the experience. They know what to say. They can answer the questions really well. And so they've been providing most of our training. So we've given kits to NC Central. We're working with Duke Police and Durham Tech Police to get kits out to them as well. So we're in the process of getting that arranged. One of our arrangements with NC Harm Reduction also is to provide nasal Narcan kits so they can distribute when they do their outreaches. They've been historically doing the injectable Narcan because, as Commissioner Jacobs noted, it is much less expensive to do that. But they had been getting a lot of requests for intranasal Narcan because people are more comfortable with that who are not substance users. People who are substance users, it's not a big deal for the most part. I'm quoting Lofton and Wilson with NC Harm Reduction for this, but he tells us that it's not really a challenge for them, but for other people who are not substance users, using injectable Narcan is very intimidating, and they're much more comfortable using the nasal Narcan. So we're providing 100 kits per month for them to add to their outreach. Our ambulances, or crews on our ambulances, also have Narcan kits that they are able to distribute to the public, whether it's on an overdose or whether they're at Sheetz picking up a soda or whatever. If someone comes up to them and says, can we have a Narcan kit? They have kits available that they can distribute as well. And of course, our community paramedics, anytime we do post-overdose response, they provide Narcan kits to the persons that we see, or family members or friends or whoever is there. We're not going to discriminate. Anybody wants a kit, they get a kit. All you have to do is just let us know. And as far as first responders go, we also just recently through Durham T.R.Y, thank you, Dr. Boone, for facilitating this. She got Narcan kits into the schools through the school resource officers, and we were able to help provide some of those kits for that. So we're very glad for that partnership. Of course, it's always a pleasure to partner with Dr. Boone anyway, as I'm sure you are all aware. So who have we been on? So that's first responders. And again, that was the first part of the grant. It's called the First Responder Comprehensive Addiction and Recovery Act grant. So that's the emphasis of the grant. But again, I said that the community sector is also a part of this grant. So who have we been working with in that? Well, we provided, as Dennis said, the Public Health Department provided Narcan kits for the Durham County Public Library, but we worked with NC Harm Reduction to help provide the training for them for their Narcan kits, along with our risk management department and other, get all of this worked out. So we've provided education for them. The NC Central Student Health Center also got kits from Public Health, but we provided the training for them as well. And I went out and provided some training for RTI International. They are doing research on fentanyl and the effects of fentanyl and the various things that they see what they can find out about it. And they wanted someone to come and talk to them about the risk of fentanyl and how to use Narcan kits that they have on hand for their staff who could potentially be exposed to fentanyl during the testing processes. So I was able to go out and do that. Other places where we've only distributed Narcan kits, the Durham Center for Senior Life, the Community Safety Department, we provided kits for them until they were able to procure their own kits. So they've done that. Again, we've worked with Dr. Boone and provided a few kits for her. A company called Butterfly Effects is out of Fayetteville, but he's doing some work in Durham as well. We provided some kits for him, and they go out into places like vape shops and other places that where there's a potential to have a population there who could overdose. And so we were able to get some kits into their facilities as well through Butterfly Effects. We've given kits and training for J.J. Henderson Senior Apartments. They have a group of captains, and I forget the exact title of what they call it, but just people that are designated within that apartment complex to respond to emergencies and to help direct the police or the EMS or fire or whatever. So now they have Narcan kits available because seniors can overdose. Sometimes it's illicit substance use, but sometimes it's medication overdose from prescribed medicines. So we provide training in Narcan kits there. We've given kits we did an outreach. We had a Narcan party last week at the Justice Services Center. So we provided training with NC Harm Reduction and provided kits for them. This Thursday, the Durham Neighborhood College, I'll be doing a presentation about Narcan and providing kits to anyone who's interested when we do that. We've been to vendor fairs and provided kits throughout all of that. So we're giving out a lot of kits and a lot of information about Narcan and fentanyl. So I didn't do a slide for the next part, but as I said, we were approved for year 2. And while we're still going to continue making sure our first responders have kits, our main focus is going to be the community, working in the community to identify places that are high risk, particularly places who probably aren't going to buy their own kits, because as Dennis said, they're not cheap. We're getting them for $41 a piece, by the way, Dennis, just so you know. That $3 might help you. But, we want to look for places that could benefit from having Narcan kits on site, but are not going to be purchasing their own most likely. So we're going to be really focusing on that. I have a program manager, Monique McKithen. She's doing a wonderful job and excited to see what she's going to get done over the next year. So that's going to be our main focus, and also fentanyl test strips, because we haven't really focused on getting those out. We've got them. We want to get those out, and we're going to really be ramping that part of it up as well. So thank you for the opportunity to give you an update about what we've been doing.
Thank you.
Wanda, I'm just doing a time check because it's 6:45 and we have your presentation as well. So maybe we'll just have time for a few questions.
Does anyone have a question for Helen? Okay, thank you so much. I will go next and last. So in terms of naloxone distribution in schools and the community, and I'm working with Monique in order to expand what we've been doing. And so we have provided naloxone to all of the SROs in middle school and high school, NCCU, and also in public housing. The work that we're doing in public housing actually has more to do with an expanded health ambassador leadership program. And let me say that in 2018, I and some others were trained at UNCG in harm reduction, naloxone administration. And so there are several trainers on how to administer naloxone here in Durham. So individuals in public housing will receive information on adverse experiences and self-care, opioids, overdose, and Narcan use, naloxone use spray, substance use and violence prevention, the power of working together or Ubuntu. And what does this look like for individuals, for interpersonal relationships, for community relationships, and in order to change social norms? Because as I said, many of us were trained at UNCG in terms of harm reduction. One of those that were trained was a mom who lost her son due to overdose. And so this topic is very dear and near to us. And I'm really happy for all of the information that we have and the ways in which we are using harm reduction. But if we don't have prevention, then we might be in the same place as we are. And so cohort 1 include individuals in public housing. This also includes a free scholarship to attend Durham Tech for individuals to receive their CHW Community Health Worker certification. So all of this is free to individuals in public housing, and we're full with cohort 1. Cohort 2 includes other community members. Public housing is a place that is positioned, excited, and willing not only to be trained in prevention measures, but also to administer naloxone. And so working with Monique has been a pleasure. I just want to say that, Helen. And I look forward to expanding this program of naloxone distribution in public housing with further concentration in districts 1 and 4, which are the districts of most color in Durham. So that's it for my slides. And do you have any questions for me?
Dr. Boone, I don't have a question, but I do have a comment if it's okay.
Okay.
I just wanted to share that working with District 1 and 4 and the work that we're doing with T.R.Y has been a great outcome. And that, like I mentioned earlier, stigma is very real, and we have T.R.Y, as a community health worker, has been a great outreach, boots on the ground, to help reduce the stigma of simple as getting naloxone and distributed with families and individuals of Durham Housing Authority public housing, and it has been great so far.
Thank you, Nancy. And so, anyone else before I give the concluding remarks with 10 minutes left in our schedule? I think.
I just wanted to jump in, Wanda, before you wrap it up, is since we kind of cut Helen short, I did have a question for you, Helen. Could you tell us what the total amount is that you have in the grant funding? What the total amount will be over the 4 years?
It's about $1.5 million.
Wow, that's fantastic. So that is really, really great. I just had a general comment for folks, kind of following up on what you said, Nancy. What people's experiences are like with the fentanyl strips, and whether people are finding that those are effective, because it seems like, from the report that we heard from Colin Miller, That's kind of the first step is the fentanyl strips. It's not as accurate, but it's cheaper than the machines. I don't know, maybe you could give us an idea about the cost of the fentanyl strips, but I mean, we literally have people dying in our community from fentanyl. I mean, it is, I'm sure you have your own personal experience that with people whose children and loved ones who just did not know that this was in something that they were taking, and especially when people are alone and there isn't somebody there to help them who may have Narcan or naloxone. But so I'm just wondering what people are finding that is really effective, and what their thoughts are about also the fentanyl strips, like a two-pronged approach.
My opinion on fentanyl strips is, even though they do sometimes have false positives, that could be enough to keep somebody from using that substance at that moment if they're afraid that they're going to be overdosing on fentanyl, or maybe they would use a lesser amount. So I think it's worth that risk. I was going to look up the cost of what we were paying for fentanyl strips. It's really not that expensive from what I remember.
Helen, we're paying about $2 a strip, and I think that's the lowest you're going to get.
Yeah.
And if anybody is interested in purchasing fentanyl strips, I've got a good connection to Loch Ness Medical, which is one of the premier fentanyl strip distributors.
Arthur, could you put your contact information in the chat too? For folks, if anyone wants to follow up with you. And also wanted to recommend that everyone just make sure they put their name in the chat in case they haven't, just for attendance purposes.
Wendy, what are your thoughts concerning prevention? I know we're prevention and education, but where do you think prevention fits in this whole scheme of opioid overdose, the issues that we're having with other substances? And I know you've seen my presentations, so I don't expect you to report on those. But I'm just wondering what your impressions are in terms of where it fits in Durham County's quest for hopefully preventing what we're seeing now. And harm reduction is key as well.
Well, I mean, it's all important. There's not one thing that's more important than the other. Obviously, everything is important. Yeah, I mean, education is important, prevention, but I also see harm reduction being tied to education as well. As we heard Colin speak about people understanding what is in the drugs that they're taking is education. It's empowering people. And I think that all the work that T.R.Y does is very much rooted in empowering people as well. So I don't think there's one that more important than the other.
No.
It's all vital.
Yeah, that wasn't the point.
We need all of it.
Yeah, it wasn't the point to try to make a plug for prevention over harm reduction, because they're both extremely important. When I look at data, and maybe I'll have a chance to share this, but last Tuesday, I did a presentation on why, where, and how our youth are using substances. And I know we just have 4 minutes left, so I'm not going to take 4 minutes. And according to the data, we really need to start looking at this and talking about this before someone turns 8 years old. And so our youth coalition, ages 9 to 17, we do elementary school. Also, that's just something that we need to keep our thoughts around as well. Okay. So, does anyone have anything to share, any updates in the 3 minutes that we have left? And then the only thing that I'll do is to announce that our next meeting is January 25th, 2024 over Zoom. Any quick announcements, activities that are coming up?
I have one quick one, if I may.
Yeah.
I would like to welcome Dr. Logan Adams. He is the new, I forget your exact title, Dr. Adams, but he's working with addictions medicines at Duke Outpatient Clinic, and you have your own clinic as well as elsewhere in Duke as well, right, Dr. Adams?
Yeah, that's correct. Yeah, and I don't know my title either yet. So we're in the same boat. But yeah, so I'm an addiction medicine physician, and we're currently at Duke working on kind of building out addiction medicine service line. And so we'll have clinics in different departments, but I'm working to integrate that within our primary care practices. And so Duke Outpatient Clinic is one of my sites as well. And Captain Tripp and I met because we're connected through kind of creating these partnerships. We have a partnership with Durham Tech, and Whitney Young is also on the call. And we are currently working on a mobile unit to provide addiction medicine services and partnering with the North Carolina Harm Reduction Coalition to do that unit. So just things happening currently in process. We haven't had our first clinical session yet, but just to update on kind of what's going on in the community. That is something that's on the horizon here.
Thank you. And I was going to also introduce Whitney Young. She is in charge of the mobile medical van that Durham Tech runs. They've been doing that for a few years now. So welcome.
Thanks, Captain Tripp. Appreciate it. Yeah, we're excited to dive into this realm, and we've been doing some work with mental health in the schools and see the growing need in that arena too, Dr. Boone, as you were talking about that. So I'm excited to endeavor in this way.
Yes, I look forward to reaching out to you as well. So Wendy, you can take us on home.
Well, thank you, everyone. This was a fantastic meeting. I know I learned so much about all the great work that everybody is doing, and really appreciate everyone being here tonight, and hope that some people can follow up and partner with each other after this meeting as well. So thank you so much, and have a great rest of your night.
Thank you. Finishing on time, Donna. Bye, everybody.